Mobile radiography. Taking a look at air fluid levels. In picture A, we can see that the X-ray tube is positioned perpendicular to the image receptor. And we're looking here at the not having a horizontal beam. And so therefore we see no air fluid levels in this picture. In picture B, we're looking at the beam, the cassette being perpendicular to the image receptor again, but this time we're using a horizontal X-ray beam. And now we can see the air fluid levels in our image of the coconut. In the third one, which is letter C, we're looking at having a cassette which is not perpendicular to the X-ray beam, but using a horizontal X-ray beam. This would come in handy if a patient is unable to sit upright, but yet we want to see air fluid levels. And in this case, we can see the air fluid level. In option D, we're looking at having the cassette lying more of a semi-Fowler's as in C, except for we directed the X-ray beam perpendicular to the image receptor, and we lost our air fluid levels here. So the moral of the story is we have to have a horizontal beam, as we do in B and C, in order to see air fluid levels. So here's an example of a patient in which we are just noticing that if we may need to see air fluid levels, such as to possibly look at this, might be an air pleural effusion down here, that it would be important to see air fluid levels. Distance is important. We have 40-inch distance, we have 56-inch distance, 72-inch distance. It must be measured accurately. And whether our patient is upright, which we would be using the horizontal beam over here at D, or if they're more semi-Fowlers, we would use A. Regardless, we want the longest SID possible, and that is to increase spatial resolution and decrease the size of the heart. With grids, it's just important to make sure that the central ray is directed perpendicular to the grid. So if a grid is used, then we have to be careful with alignment. Otherwise, we get grid cutoff. This concludes our lesson on mobile radiography.